Meanwhile, the Minister of Health, Dr Joe Phaahla, just speaking in public about this, including issues around the COVID-19 pandemic, the measles outbreak, and the state of readiness of emergency medical services during the holiday period. Newzroom Afrika's Ziniko and Mhlaba covering that briefing for us. He joins us now. Ziniko, good afternoon to you. What was the main message from the Minister there?
A very good afternoon to you, Stephen. Well, the main message or the main issue we asked or posed, the main question we posed to the Minister was that issue of load shedding and how it's affecting the health facilities. One of the questions we asked was that, which I asked specifically, was that is he happy with the way in which the state, the Department of State Enterprises and also Eskom is handling the issue of load shedding at various hospitals. The Minister saying that, making it very clear that he's definitely not happy at all. He's saying that as much as there's an update which we get from Eskom on a daily basis about the possible reasons behind this load shedding, but he's saying that that information, that update is not enough at all. All they care about and all they want to know is that there is energy, there is power at various facilities so that they can be able to provide the healthcare which is very much needed by the public of South Africa. The second issue, Stephen, still on that issue of load shedding, was the cost factor of running diesel generators for these public hospitals, especially when there's load shedding. So the Minister is saying, as far as that is concerned, he cannot pin it down to an amount. When he was asked how much exactly is the department spending in purchasing diesel so that when there's load shedding, hospitals are able to function, he's saying that there is no amount that has been consolidated yet nationally. But what he said was that various provinces are consolidating their costs. He was also mentioning the fact that there is no national budget that is directed towards facilities, towards health facilities. He was saying that each and every province has its own budget, and load shedding or purchasing of diesel is not a primary need, especially which has to be attended to by that budget allocated to that particular hospital. Is saying that this was not budgeted even in the financial year, so they do not have enough budget to ensure that various health facilities have enough diesel. So that was the issue. Another issue the Minister spoke about was that it was the capacity of the department to provide emergency care, especially as we are getting to the festive season. He was mentioning the fact that, well, they will be working in partnership with the Department of Transport to ensure that emergency services are available and are provided to the public, especially during the festive season.
We seem to have lost Ziniko Mhlaba there. Do apologize for that. I don't know if load shedding can be blamed, but let's blame load shedding anyway for that. Certainly you can know the problems that it has. All right, the Minister